Measles cases have surged to a record high since the disease was declared eliminated in the United States. Joining us this morning to talk more about the safety precautions you can take for your kiddos right now, as well as the symptoms, is health educator Dr. Griggs. Good morning. Good Sunday morning to you.
Good Sunday morning.
Alrighty, so measles, here we find ourselves again. Just a couple of months ago, we had you on the show to talk about the first couple cases we were seeing, and now we're getting record high numbers. So what has changed in the past couple of months?
So the numbers have almost quadrupled, actually. The record was like last year they were at 250 cases. We're at 1,274. I think to eclipse the record in 2019, we're only a few cases away, which puts us almost at the point of saying it's not eliminated anymore.
Wow. So I know parents, grandparents, friends, families, people will talk about measles parties that they used to have, right? You bring your kids, everybody gets it. Highly contagious disease we're talking about. But modern medicine has changed since those days.
Yeah, they would have the chickenpox party. Modern medicine stopped. Measles is one of the most contagious diseases that we have. It's so contagious that can linger in the air for 2 hours. It's airborne. Linger for 2 hours, and let's say we have a room of 20 people that are unvaccinated. If one is infected, 18 or 19 will be infected. It lingers and lingers. What's changed is the attitudes towards vaccinations. Started with one cluster in West Texas and has now spread, again, like I said, to about 1,274 to about 34 different clusters across the country.
So put this into perspective for me. If you are an everyday average healthy person and you get the measles, what does it feel like? And then let's compare that to maybe a child or an older person.
So an everyday average healthy person that's vaccinated probably will not get the measles. With our herd immunity, we have above 95%. You're pretty much safe, but in some spaces, the vaccination rates are dropping to as low as possibly 86. So what would happen is if you're unvaccinated, you'll get a rash, there'll be a fever, it'll run its course. And then what happens is if you're healthy, you run the risk of getting brain swelling later in life and immune amnesia, meaning that it will wipe and press a hard reset on your immune system for other diseases that you've been exposed to, not just the measles. We're saying COVID, we're saying flu, we're saying all of the things that you've been protected against.
It can make you sicker later on.
Sicker later from things other than measles.
Right, and then maybe for a child or an older adult population, those are more vulnerable people.
They're more vulnerable, and what happens is you run the risk of pneumonia, and pneumonia can be deadly. It can be deadly for those at the extremes of age and those with the immune conditions, immune compromised.
Right. Alrighty, just a few seconds left here. Your recommendation to resolve this problem?
Get vaccinated. Stop the mis and disinformation. Get your vaccines. Look at the history. Talk to your doctor about what would be the best situation for you.